All of them, they are confused that what is gram positive cocci, what is gram negative cocci, what is gram positive bacilli, and what is gram negative bacilli. Okay, so this is what is the basics. Every time I tell this, and those who know, they can answer up. Otherwise, you can listen up to this particular stuff. Okay, yeah, we'll try to all first. Gram positive cocci. So for the gram positive cocci to remember this particular stuff, that all cocci, they are mostly, all cocci, they are mostly what? Gram positive. Okay. All cocci, they are mostly what? Gram positive, except, except the four. Okay. Except the four. And which particular fours? One is gonococci. Okay. One is meningococci. One is Vinolela, and one is Morixella. Okay, so these particular four, they are termed as gram negative cocci, and rest of all others are what, guys? Rest of all others are gram positive cocci. Okay, so even if you don't know the name also, na, if I ask you now what is lactococcus, that is gram positive. What is micrococcus, aerococcus, planococcus? You never have heard of their names, but now you know that these particular ones are what? Gram positive. Okay. So this particular one, first of all, you should be clear that these four, gono, meningo, vinolella, morixella, what they are? They are gram negative cocci. And rest of all others, cocci are what, guys? Gram positive. Okay. Is it fine or not? Is it fine or not? Okay. So remember this particular one. Similar confusion happens in the case of bacilli. All bacilli, they are gram negative. Okay. All bacilli, they are gram negative except, okay, except your favorite burger station, McD. Okay. McD, they are gram positive bacilli. Okay. So if you have done it from somewhere else, it's also okay. And if this particular one you want to use up, that is also fine. Fine. So gram positive bacilli. M is what? M is Mycobacterium. Okay. Mycobacterium, different species of Mycobacterium. So first of all, I like to tell you the Mycobacterium is not gram positive. Why it is in this list? If you get after this particular Mycobacterium, then it takes the stain of gram positive. But Mycobacterium as such is what? It is acid fast. It is acid fast. But by chance, if you want to stain it by gram stain only, then also it gets stained. And it stains which color? It stains gram positive color. Is it fine? I will tell you what are the colors and all. First of all, you remember this. A is what? A is anthracis. And which particular anthracis? Anthracis bacillus. Okay. C is Clostridium. What is C? C is Clostridium. And different species of Clostridium. If you remember up, what are the different species of Clostridium? Important ones. As such, a lot of others are there. Important ones, Clostridium tetani, Clostridium perfringens, Clostridium botulinum, Clostridium difficile. These all are there. Vulci is perfringens. Okay. D is diphthery. Okay. D is diphthery. And which diphthery? Corani or Corynebacterium diphthery. Okay. O is just for the mnemonic. N is nocardia. Okay. A is actinomyces or actinomycetes. They are the same thing. L is listeria. Okay. And D is diphtheroids. D is diphtheroids. Diphtheroids are normal commensals. What are diphtheroids? Diphtheroids are normal commensals which you and me is also having in our throat. Okay, so diphtherides are normal commensals. Diphthery is pathogenic. It causes diphtheria. And if it is coming in a case scenario like situation, what is there in that? They will say unimmunized child. They will say what, guys? Unimmunized child. Okay, develops a pseudomembrane, grayish white, and when you try to pluck it, it bleeds. So that is what is the case scenario of this particular diphtheria. Now, these all are gram positive bacilli, and rest of all others are what? Gram negative. Rest of all others are what, guys? Gram negative. So if I ask you now, what is E. coli? Gram negative. What is Klebsiella? Gram negative. What is Vibrio cholerae? Gram negative. So like this, you can remember. Is it fine? Like this, you can remember of that which one is gram positive cocci, which one is gram negative cocci, which one is gram negative bacilli, and which one is gram positive bacilli.